Welcome to today's lesson on the heart wall. In this video, we'll explore the three layers of the heart wall: endocardium, myocardium and epicardium, and understand their structure and functions. The heart wall is made up of three main layers: the endocardium, myocardium and epicardium. Together, these layers ensure smooth blood flow, strong contractions and protection of the heart. Endocardium. The endocardium is the innermost layer. It consists of a thin endothelial lining that is continuous with the inner lining of blood vessels. This smooth surface prevents blood clotting and forms the structure of the heart valves. Myocardium. The myocardium is the thick middle muscular layer made up of cardiac muscle cells. It is the powerhouse of the heart, generating the force needed to pump blood. The myocardium is thickest in the left ventricle, since it must push blood throughout the entire body. The swirling pattern of myocardium shown in the diagram on the right helps the heart pump effectively. Epicardium. The epicardium is the outermost layer of the heart wall, also called the visceral layer of the serous pericardium. It reduces friction during heartbeats and serves as a pathway for coronary vessels and nerves. It also contains fat for cushioning. Clinical implications related to these layers. These layers can also be affected by disease. Endocarditis is an infection of the endocardium. Myocardial infarction or heart attack is death of myocardial tissue due to blocked coronary arteries. Pericarditis, which can involve the epicardium, causes chest pain and a characteristic friction rub. The diagram on the right shows necrosis of a part of the myocardium resulting in myocardial infarction. To summarize, the endocardium lines the chambers, the myocardium pumps the blood, and the epicardium protects and supports the heart. Thanks for watching. Don't forget to like, share and subscribe for more medical education videos.